In this presentation, we'll be discussing the health issue of smoking in our community here in San Joaquin County. And it's presented by Anna Lilia, Nina, Cameron, and Kelly. So first we'll be discussing the prevalence of smoking here in San Joaquin County compared to the rest of the US and California. So over the time period since 1965, which is when the prevalence of smoking hit its peak, 45% of the population reported that they had smoked. And in 1997, it dropped to 25%, and in 2019, it dropped to 14%. So it's been steadily declining since 1965. And if we look here specifically in California and San Joaquin County, in 2011, we have 17% of our population who smoke, and in California overall it was 15%. So as a county, our prevalence of smoking is higher than in the state itself. So if we look closer here to a more recent year in 2018, we're still at 15% and California is at 11%. So 15% may not seem like many people. However, when you look at the percent of number of people, that's still 130,000 people who smoke in San Joaquin County alone. And in California, if you look at 11% of the population, that's 4.5 million people in California. So this still affects a huge portion of our population. And smoking in adolescence should be where we target our prevention, because tobacco products, so when adolescents start using tobacco products such as smoking or any type of tobacco product, it's mainly established during their adolescence. So 9 out of 10 adults who smoke cigarettes daily first started smoking by age 18. And tobacco companies nowadays are marketing flavored tobacco products to adolescents in order to hook them to their products, in order to increase their profits. And yes, they are aware of these staggering statistics and they are using that in order to build their own profit. So if we can prevent and educate adolescents in high school, we can greatly decrease our number of adult smokers in San Joaquin County.
Going on to the health effects of smoking. Smoking is the #1 preventable cause of death. Those who smoke are at increased risk for getting coronary heart disease. It increases by 2 to 4 times, along with stroke. Lung cancer in men increases 23 times, and in women it's 13 times. Smokers are 20 times more likely to develop cancer. Going on to women who are pregnant, it makes it harder for women to become pregnant, and it increases birth defects and miscarriages. It increases heart rate, tightens major arteries, increases blood pressure, which then increases the risk of stroke. Smoking increases the buildup of fatty plaque and injures the vessel walls. It increases the cholesterol levels of the fibrogen, and then that increases the blood clot rates of people. 80% of COPD deaths are from smokers. On a healthy lung, the average human inhales 388 cubic feet of air daily, and in smokers, that is reduced by more than half. Those who smoke, their lungs are darker and mottled from the accumulation of inhaled tar. The risk is 30 to 40% higher for active smokers to get rheumatoid arthritis, as well as the type 2 diabetes. And those who end up getting type 2 diabetes from smoking, it's a lot harder to control. It increases the risk of cataracts, and it affects the teeth and gums of those who do smoke. Cigars increase the risk of laryngeal cancer, oral cancer, and esophageal cancer. And then men's sperm is also affected. It reduces fertility.
Okay, so there is many reasons why one should stop smoking. Some of the important facts to know is that once you quit smoking, it cuts down the cardiovascular risk in just 1 year after you quit smoking. The risk drops dramatically. Within 2 years of quitting smoking, your risk for stroke may reduce to about half of that of a non-smoker. If you quit smoking, your risk for cancers of mouth, throat, esophagus, bladder drop within 5 years. Once you have quit smoking for about 10 years, your risk from dying from lung cancer drop by half. And even people who smoke fewer than 5 cigarettes a day have had early signs of cardiovascular disease. So it's very important to keep in mind that trying to quit smoking is actually very hard. It's hard because nicotine can be very addicting and have probably developed a smoking habit along with it. For example, one could be reading the newspaper while having a cigarette, so that could become a daily habit, making it hard for you to quit. It is also important that whenever you're ready, you pick a date 2 to 3 weeks out and keep a list of the reasons why you decided to quit. That way, when you have the urge to smoke, you look back and remember the reasons why you decided to stop. Knowing the underlying reason why you crave smoking can also be helpful. For example, one may want to crave a cigarette when one is stressed. So maybe going on a walk or even doing some exercise could help. It is also important to let your friends and family know ahead of time that you're deciding to quit. That way you could have a strong support system, and encouragement is also very helpful. Another thing you could also do is get help from your healthcare provider. Your provider may also prescribe you patches, pills, sprays, or even inhalers to help with this. It is also important to throw away all your cigarettes in ashtrays. This includes your home, your office, and your car the day before you decide to quit. You can also avoid going to places that you used to smoke until you feel that you can resist the need. Once you have stopped smoking, you will most likely have nicotine withdrawals. You may feel anxious, crave a cigarette, become more hungry than usual, or have trouble concentrating. These symptoms normally go away within a few weeks. You can also reward yourself weekly by saving all the money that you would buy cigarettes with. You deserve it because you came a long way. Finally, don't get discouraged if your first attempt is unsuccessful. Few people don't normally quit on the first attempt.
Okay, so resources. So as you can tell by looking at the other slides, smoking is more than just a bad habit. It's a physical addiction. So by learning the effects of nicotine and educating yourself on how it affects the brain, making an educated decision about using community resources in San Joaquin County will greatly affect your successfulness by quitting smoking. So one resource here in San Joaquin County is STOP. It is dedicated to improving the quality of life for all those who live in San Joaquin County. It's combined with a lot of organizations in our community, and STOP will work to increase access and availability to different resources to help you quit. So on here, there are some phone numbers, different websites you can go to find these resources in San Joaquin County community. That ends our presentation for smoking. Thank you so much.